everyone, and welcome to Let's Just Do This. I'm Margaret Wallis-Duffy, and alongside me today, of course, my handsome co-host, Mr. Todd Miller.
As always, where else would I be?
Indeed, and we are so thrilled to be back for a new season of Let's Just Do This, bringing some amazing people to the table to have some great educational discussions that will help to educate, empower, and inspire you to live well. And what a way to kick off this season. We've got some great guests lined up for you, and today we're really excited to have two very special people join us in studio. Dr. Marion Lyver, who is a medical doctor and has a specialty in emergency medicine. She's the medical director of the Under Pressure Incorporated Hyperbaric Treatment Centre in Port Credit. Welcome.
Thank you.
And next to her is Izaak, who is not only does a lot of work in terms of the marketing and the education, but you too, Izaak, have actually experienced hyperbaric medicine. So we're thrilled to have you both on the show.
Thank you for having me on.
So before we can go any further with this topic, we really need to let everybody know what is hyperbaric medicine and how, as a physician, is that important in medicine?
Hyperbaric medicine is not an area that a lot of physicians or patients know a lot about, so that is the key question. Hyperbaric medicine essentially encompasses giving 100% oxygen to a patient who has a particular health condition inside of a chamber, and that chamber may be for a single person to go in, or multiple people can go into larger chambers. And they go into the chamber with the 100% oxygen, and it's administered under pressure. In other words, this is a normal pressure in this room, so they are increased pressure inside of the chamber. So they may be 1.5 times the room pressure, or twice, or higher than the room pressure. So it's equivalent to, or similar to the experience of scuba diving. You're going down 30, 40, 60 feet underwater. So that's kind of the equivalent pressure sensation if you've ever experienced scuba diving. And so that's the type of equivalency that you would appreciate for that person when they're in the chamber. Generally, they're fine. They don't really notice much problem in the chamber, but they may have some problems with their ears or their sinuses. The same as scuba divers might experience, or you might experience going up, changing pressure, altitude.
Yeah.
Otherwise, the majority of people are quite comfortable in the chamber, and they feel quite good.
Right. Now, can you explain to us, just on a high level, some of the benefits and the types of people, if they're listening or watching at home, who might benefit from oxygen therapy?
There's a lot of different types of patients who can benefit from oxygen therapy. In Ontario and probably the other provinces, there's probably 14 different categories of conditions that the provincial health plan will actually cover. And those include a lot of patients who have wounds that aren't healing, related to diabetes.
Right.
Because they have poor circulation, they have nerve damage because of the diabetes. Patients who've got poor other types of circulatory problems in their legs in particular, or they have wounds from other problems. They haven't healed from surgery, they've got bad injuries that aren't healing properly. So that's a big category of patients. Other groups of patients are those who have radiation injuries from chemotherapy. Many patients get chemotherapy for their cancer, and they get radiation as well, and so they suffer nerve damage from the chemotherapy. They may also suffer tissue damage from the actual radiation. And it might not happen for 12, 13 months or 2 years, longer, after the radiation is administered. So then they will come in with things like bleeding from their bladders, bleeding from their rectums, tissue pain in the area that was radiated. And those patients respond very nicely to hyperbaric treatments, right? So that's another big category. Outside of that, there's people who have sudden hearing loss.
Right.
OHIP will also cover those patients. If we get them in time, the hyperbaric oxygen can actually help that recover some of the hearing, right? Outside of OHIP, there's a lot of other conditions that we also treat, things like concussions.
Yes.
Patients who have post-concussion syndrome, as we call it. They have bad headaches, they feel dizzy, they can't concentrate, they can't use their computers, they can't sleep properly. A whole set of symptoms that concussion patients suffer. So those patients actually do very well in the chamber, but OHIP's not paying for them yet.
Right.
We're working on that.
We're working on it. And that's why shows like this are so critical to educate.
So that just give you a touch.
Yeah.
Yeah.
It sounds like there's a lot of benefit. You're in marketing, Izaak. We've heard over the years of various celebrities that have invested in this technology, and it seems like it's been a really well-kept secret. You have, in fact, used this technology, this treatment.
Yes.
And you've benefited. And can you speak to what your treatment was like?
Yeah, so I've been doing hyperbarics for close to 10 years now. I've come in for anything from minor scrapes and bruises. I've gone in for a few concussions. I had shoulder surgery about 4 years ago, and I came in for that post-surgery to get my wounds healed. It sounds terrifying because it's a very large name, but really it's very simple. Your treatment is basically you're laying down in a chamber or standing up, and the chambers that under pressure uses is mono chambers, so we have TVs hooked up to all of them. Other ones are different, of course. You have the soft shell ones that most athletes use, and you have the group ones.
Soft shell?
Yeah, so they're portable plastic ones that use an air tank instead
Wow.
of ones that are hard place. A lot of sports players and athletes like LeBron James would use one like a soft shell. Hard shell ones are mainly for more serious conditions.
Less portable, I guess.
Yeah.
Yeah.
Well, the soft ones you can't see either out. They're dark.
Yeah, they're zipped up all the way with
There's a
nothing.
claustrophobia issue in some of
Absolutely.
those.
Okay.
Patients actually
Yeah.
can't see out, whereas we have the chambers that you can see all around.
Yeah,
Oh,
the
that's-
monoplace chambers are 100% acrylic glass
Yeah.
on the outside.
Yeah, I had the privilege and pleasure of doing a bit of a tour prior to having you come on the show. And, clearly, like you said, people are watching Netflix. They look very comfortable. They can see it's a beautiful environment and a welcoming environment. And I think that speaks, and it's really important, when people are coming in pain and they're frightened and they've tried a lot of things and they really don't know where to turn. All of those things matter. And one of the things I felt, Todd, when I walked into this place was these people care. And the treatment, right through, it really is very integrative and holistic, which I really like.
It's a very calming environment.
Yes.
We try to set it up so it's a very calming environment. And the chambers themselves are calming. Because
Yeah.
once you're in there, you're kind of in a little cocoon.
Yeah.
Right? So it's generally intended to be relaxing and calming while you're getting the treatment itself.
But I love the fact that there's things like Netflix so that if you are feeling a little bit uncomfortable, you can sort of gain some normalcy by being in there and watching your favorite Downton Abbey episode or something.
Exactly.
Yeah.
One of the things, Dr. Lyver, that you made reference to when you first began our discussion was talking that more than one person. I know that you were telling me a story, and I think it's important for our listeners to understand. Parents have gone in with their children. Is that correct? So that and can you give us an example of why that would be the case?
Parents and actually other adults can go in with elderly patients too.
Right.
The chamber is intended for one person, but it's big enough so that two people can quite comfortably fit in there. Not two people Isaac's size,
Yes.
but a parent and a child can easily fit into the chamber. And often, if you've got a small child, they're anxious.
Yes.
They're concerned. This is a new thing for them. They're not sure what's going on.
New people
It looks
around.
kind of
Scary, yes.
right? So the parent will go in with them quite often, and for the child, it's very calming. And we have a number of children that have autism
Right.
that go into the chambers. It's been shown that autism, in fact, does have inflammatory areas in the brain. That's what's contributing to the autism. And it's also low blood flow to certain areas of the brain for autistic kids. And those things are all improved by hyperbaric treatment. So we get autistic kids that go in there, and obviously they're anxious, they're kind of hyper, they've got some behavioral issues. So putting them in a chamber on their own is not something that you'd want.
So just before we go to break, could you speak to, and you just said a couple of them there, increasing circulation, can you speak to a couple of the physiological benefits? You talked about some of the conditions, but what are some of the physiological benefits of
Well,
oxygen therapy?
there's a large number of them, and it's quite complex, actually, the physiological impacts of hyperbaric oxygen treatment. But the major ones are, obviously, you're driving high concentration oxygen into every cell in the body. Normally what we're breathing is 21% oxygen, that's in the air,
Right.
but we're providing 100% oxygen. So that alone, you're enhancing your whole oxygenation of every tissue and every cell. And then when you add the pressure, the additional pressure beyond room pressure, you're driving that oxygen in even further into parts of the body that normally aren't getting very well oxygenated. And that's the difficulty with a lot of these wounds. People have poor circulation. and they've got other problems with infection, they're just not getting that oxygen to those tissues, right? So you're actually getting a great level of oxygen to the tissues. And the other thing it does, it stimulates the growth of new blood vessels into these damaged areas. So the healing is faster, right? So the high oxygen, the impact on new blood vessels, and a lot of other things. It kicks your immune system into high gear. It also activates processes that clean up wound debris and material around the wound that's not getting cleared out from the body. So, and that's a fairly complex physiological process, but all of those things contribute to healing. Right. As Izaak said, he's been in many times getting wounds healed and post-op things healed up, and we have a lot of post-op patients that come in too.
And just briefly, are there any contraindications or particular types of people that wouldn't qualify for this type of treatment?
We don't put patients in the chamber if we know for sure that there's very little evidence that we're going to be able to help them. Like I don't see people spending money or spending time and effort to get a treatment that there really is no proven effect for it. So I will tell them directly, we don't really feel that we're going to be able to help you. In other cases, we can't put people in simply because of the condition they're suffering from. We've got, for example, there's a couple of Alzheimer's patients who, have come to us to see if they can get treated for their Alzheimer's, because there is some new evidence around the impacts of Alzheimer's and how hyperbarics can treat that. But many of those patients get very paranoid, get claustrophobic, and they get very anxious inside a chamber. So it's very difficult to put them in. Other things like very high blood pressure, we will not put them in the chamber. Certain medical devices they might have, certain types of pacemakers. So there's a lot of different conditions we check for to make sure that we're safely putting people in.
Okay, so we're going to take a break, but when we come back, I'd like to talk about that process and what someone can expect when they walk through the doors of your clinic, so that they're going to feel confident in the treatment that they're going to receive. And we've got lots more to talk about the benefits of oxygen therapy. So stay tuned. We'll be right back here at Let's Just Do This.
Welcome back to Let's Just Do This. I'm Todd Miller, along with Margaret Wallis-Duffy. We're talking about hyperbaric oxygen treatment, and so I've decided that I want to investigate this. What can I expect the first time? Am I going to get in there and just hop in the tub and away we go?
No,
okay.
Definitely not. No. We have a whole process whereby you as a patient need to be referred to us, either by your family doctor or by a specialist that you might be seeing for whatever your condition is. And nurse practitioners can also refer us in. That will cover you under OHIP for an assessment. So, because you do need to get an assessment by a physician or a nurse practitioner, we have physicians at our facility, before you actually get any access to the chambers. We need to clear you medically, understand what your health problem is, determine whether it is amenable to hyperbaric oxygen treatment, and then determine whether you have any contraindications to getting in the chamber, because there are some contraindications for you getting in. Once we clear you medically, and that session or that assessment should be covered by OHIP, right? Once we clear you medically to get treated, then we will set up the treatment sessions. We will decide how much treatment you need, how long you need to be in the chamber for, and at what pressure you need to be in.
A lot of variables.
Yeah, and there are a number of guidelines that are out there in terms of standard guidelines around treatment times and treatment pressures for different conditions. So we try and adhere to the guidelines where the guidelines exist. If there's not a set of guidelines, because some patients will come in with conditions that OHIP is not paying for, there aren't specific guidelines, so then we will have to determine what makes the most sense based on current research for that patient, right? So then we'll set up a schedule for them and we'll get them started.
And I did notice when I was there having a bit of a tour and somebody was actually in the chamber, you have someone seated where the chambers are and always available to that patient.
Yeah, we have to have technicians. I mean, that's a critical part of the overall treatment. The physicians are usually within the chamber area as well, are available to deal with any kind of problems that might arise. But the technicians are monitoring constantly what you need to do, what you can't have in the chamber, what it will feel like. They'll go through the whole process and prepare you to get into the chamber, and then they will monitor you the whole time.
Right.
right?
Excellent, excellent.
We're all familiar with the current opiate crisis that's going on, and in our society we've turned into a pill for an ill, and we're trying to get away from that. And this sounds like a wonderful tool to potentially reduce some of that use. Can you speak to that a little bit?
A number of the patients that we do see do have chronic pain. They have chronic pain problems related to chronic disease, usually, of some sort. And those patients, when they get in the chamber, a lot of them do get pain relief. Some of those conditions, again, aren't covered by OHIP. I think Izaak is where we have a fibromyalgia patient that comes in quite regularly for fibromyalgia treatment. She doesn't want to be on opiates. She got off of all those medications, and she comes in. She had a lot of sessions in the chamber initially, I think probably up to 40 sessions, and then she comes in once every 2 weeks.
Like maintenance?
Yes, she's on a maintenance session, and she's no longer taking any medications.
That's fantastic.
Fantastic.
Yeah.
Fantastic.
So there's patients like that, patients with a lot of pain associated with their condition can actually get off of or reduce their opiate use.
That's great news.
Yeah.
So Izaak, you've said that you've been using the chamber since you were 12 years of age, and I mean, you're really old now. But as a sports guy and with many different injuries, can you speak also to the frequency by which someone can expect to use the chamber, and for what reasons?
Yeah, so it really varies patient by patient, with regards to their availability. Somebody may have, their family to look after, or somebody my age may have school. We try to tell our patients, or anybody that wants to use hyperbarics, that the more you use it, the better. So the treatment definitely is more successful when it's done, maybe 3 or 4 times a week. But again, it really depends on what kind of condition you're coming in for. We have patients for general wellness that come in once every 2 weeks, and they're just doing their session. There might not be anything wrong with them, but they just want, that extra health kick.
Imagine that. They want to prevent illness
Yeah.
and live well. Yeah, we love that. We love that.
Yeah, and the amount of time in the chamber varies too. You have to understand that you are going to have to spend some time in the chamber to get treated. It can be anywhere from 45 minutes,
Right?
or generally it's 1.5 hours. Some patients with wounds that are healing, 2 hours.
Okay.
Right, so they're actually in the chamber for that period of time, but they're either sleeping, meditating, watching TV. We have one patient, she just watched comedies the whole time. Every time we walked by, she's laughing. It was quite funny.
I bet.
But she
I bet.
was happy.
Yeah. Now, there's, at my clinic, and we do see a wide range of people suffering with all different types of chronic conditions, but one in particular that sadly we're seeing a lot more of, and it's very difficult to find treatment for, and that's Lyme disease. Can you speak to some of the experience that you've had with oxygen therapy in the treatment of Lyme?
Well, Lyme disease, particularly chronic Lyme disease, and if it's proven Lyme disease, there is a lot of research and protocols out there around the use of hyperbaric oxygen treatment along with other therapies for Lyme. And those patients will benefit from hyperbaric oxygen, mainly because the Lyme organisms themselves, they thrive in low or non-oxygen environments.
Right.
So they don't like oxygen. They don't want oxygen. That oxygen kills those organisms. So once we put patients in a hyperbaric chamber, if they still have organisms that are lurking in various organs, which is the problem with Lyme, the organisms stay in your body for a long time.
Yeah.
They just hide in places, right? It can actually kill those organisms or inactivate them, so that they're no longer causing the symptoms or the problems that the patient's experiencing, which can be a wide range of problems.
Yes.
I mean, you name it, patients with Lyme disease can have it, right? So they actually experience either killing or inactivation of those organisms and improvement in their symptoms. Right? I've just had a patient who just finished Lyme treatment for Lyme disease. He had 40 sessions, and he said he's finally back to himself.
Oh,
He finally feels normal again.
that's great
Right.
news.
Got rid of all the symptoms and things he was experiencing, right? So it's part of known treatment protocols. He was also using antibiotics prior to coming in. Generally, they try and treat with several antibiotics before they get the hyperbaric therapy.
Right.
So it's kind of a supplemental treatment and help to resolve the actual organism problems that are caused in the person's body, right?
So you've made reference to OHIP covering, and then we've also talked about that if you want to pay out of pocket, you can certainly have this type of therapy. What about extended health or WSIB or that type of coverage? Is there any support in that regard?
The insurers will not advise you that they're going to pay for hyperbaric treatment. So you as the patient really have to go and talk to your insurer. So if you have an employer insurer, whether it's Sun Life or Manulife or any of those types of companies, you have to go specifically and ask for, will you cover hyperbaric treatment for this condition that I have? And then their team will assess it. They'll make an assessment and get back to you with a determination as to whether they're going to pay, right? Otherwise, you yourself will have to pay out of pocket, or if you have a workers' comp case, it may fall under workers' compensation, or if you have an accident claim in a motor vehicle and you've ended up with a crush injury, for instance, which is one of the things we'll pay for, but not 2 years later. Right? But if you had a crush injury of some sort in a vehicle accident and there's an insurance claim, that insurance claim most often will pay for hyperbaric treatment for a lot of different conditions that might fall out of that accident.
Now, you mentioned during the break, too, it's important to follow up with your insurer because their policies change from time to time. So you may get an initial no, but then if you keep asking, it may turn into a yes.
No, the insurers aren't going to come and tell you that, oh, we're going to pay for this. You have to go and ask them. You have to present a case to them. They will examine it. But initially, they might say no. But if you go back every 6 months, which I counsel my patients to do, check back every 6 months and see if they've changed the policy. Right. They may have added it as coverage at that point. Right. So.
And what I love about what you're saying, and there's many things that I love about what you're saying, but I do love the patient empowerment piece and the role that you're playing in that. I mean, as a physician in emergency medicine, I mean, your resume, ladies and gentlemen, I didn't read this lady's resume because it would be the entire show. It's very impressive, Dr. Lymer. And you know, one of the things I love about your approach is that you really do look at things integratively and empowering the patient, putting them at the center. Why, as a physician, does it matter to you? And you know, with all that you could be doing, why did you choose hyperbaric medicine as one of the areas that you're really focusing on?
Well, hyperbaric medicine, I mean, it is really part of an integrated approach to healthcare. And patients themselves, it's one of the things that patients themselves seek out. I mean, patients now they should be at the center anyway.
Yes, indeed.
But patients are putting themselves at the center, and they're really doing their own research. They're looking at what their options are for treatment. And many of them actually identify hyperbaric treatment themselves as something that's going to be able to help them, or they believe it will. So they go and seek it out. And it is a natural treatment. It's oxygen.
Right.
Oxygen plus pressure heals. Right? I mean, it's kind of a simple message, right? And many of the patients are already doing other types of therapies too that are going to help their condition, whether that's massage therapy, chiropractic, supplements that they're taking,
nutrition,
using their managing their diet, those sorts of things. So we're part of that holistic approach, essentially. And it's very helpful for them. It also stimulates and supports the effectiveness of those other treatments. Right? So once you're in the chamber, you're feeling better, you're healing better, your immune system is more activated, then those other treatments have a better chance of working.
Isn't that awesome? Yeah.
Supportive medicine.
Yes. There are so many people that are suffering nowadays with respiratory conditions, you know, like COPD or emphysema. I tend to have a bit of a soft spot. During my undergrad, I worked at St. Mike's in the pulmonary function lab and learned a lot about lung health. Can you speak to, because I think there's probably some people at home thinking immediately, oh, I've got COPD or emphysema, this is the place for me. Can you speak to maybe some of the precautions and things that we have to be aware of?
Lung disease is a funny, well, it's not a funny category, but it's a different category because one of the side effects from, or potential adverse effects from being in a chamber is it can potentially aggravate lung conditions. So it's one of the areas we explain to patients. Because you've got patient getting oxygen under pressure, that pressure can be reflected sometimes into the lungs, into your ears, into your sinuses. So you may get pain, discomfort, ear pain and plugging, or discomfort from the ears, and with the lungs too. Asthma is actually, most of the asthmatic patients are okay. Like, we screen them first, we check their lung function, and we see how they're doing overall with their asthma. So depending on the condition we're treating, we will let a number of the asthmatics into the chamber. COPD though, like bronchitis, emphysema, the main issue there is a lot of them have overinflated lungs. Right. And they have what we call bulla in their lungs. So the overinflated areas inside the lungs that are like balloons waiting to break, waiting to rupture. That's the damage done to the lungs from smoking, primarily. So in those patients' situations, we put them in the chamber, those balloons, areas could actually rupture.
No.
Which is not what you want to have happen, right? So they would end up in severe respiratory distress. So we will not put patients in who have any of those kinds of problems with their lungs. But we do screen them, we run tests on them, and we'll let them know whether we can treat them or not. But it's one of the areas where we're very cautious with patients putting them in the chamber.
Right. You know, Izaak, being a young, strapping man like you are, and in your generation, can you speak, do you think, to, because I've noticed, I have a son who's 23, and perhaps, I mean, yes, he's been raised in a home where we look at prevention and integrative health. That's something that, the way we live our lives. But do you think from your generational perspective that treatments like this, your generation are really keen and interested in?
I don't think enough people my age know about it, which I think is the biggest issue, is that it's so young in Canada, but it's been used everywhere for several years, that not enough people, might not even be in the field just in general, are unaware of how much hyperbarics can actually help you.
Right.
Especially at such a young age, coming from a sports background, I see a ton of my friends or close teammates have concussions, any kind of injury that can prevent them, not just now, but later on when they grow
Indeed.
up. And it just sucks knowing that there's something out there that can help them, and they don't know about it.
Right. Well, that's why...
You just spread the word.
That's right, and that's why we brought you on Let's Just Do This, because this is a place where we like to educate and empower people through information like you've both shared. So we want to both, Todd and I want to thank both of you for coming into studio today. I hope this won't be the last time, and we certainly want to bring cameras into the center so that people can actually see what goes on there, which is so important. So thank you for your time and energy today and your expertise.
Thank you for having us.
Thanks.
So if you want more information about oxygen therapy, be sure to visit Under Pressure, the website, so you can get more information. And of course, we want to hear from you here at Let's Just Do This. If you have a topic that you want to know about, or perhaps you have a question for one of our guests, follow us on all the channels, Facebook, Instagram, LinkedIn, we're everywhere. And until next time, we hope that you will live well, stay well, and we'll see you soon.